Hi, everybody. This is Joanne Hayes, nurse practitioner and director of the diabetes clinic at APD Primary Care. This is just a very short video for flow staff on how to obtain, order, and sign per protocol orders for A1C and for microalbumin, urine microalbumin. So first of all, the urine microalbumin is a test that's done yearly for patients with diabetes. It's a test that monitors kidney function. And the A1C is a blood test that monitors the average glucose over a 3-month period, and we usually get this every 3 months. So when you're deciding which patients need these tests, you want to look at the schedule of the provider that you're flowing for, and you want to look under appointment type and under notes. If the patient has a physical, you want to open that up and see if they have a diagnosis of diabetes. And if they do, then you're going to be checking to see if they're due for these tests or if they're coming in for a diabetes follow-up. The next step is to look into the health maintenance tab, and you're going to see what they're due for. And this person here is due for the urine microalbumin. You can also go down and see what's upcoming, and you can look at the A1C. And if it's due in 2 weeks or less, then you might want to order that as well. When you're ordering, you type in the order, the microalbumin, and then you choose the urine microalbumin test. You need to change it to normal and to clinic collect. And then for the A1C, it's normal and point of care A1C. And then you need to assign a diagnosis to these orders. So you go in to assign the diagnosis, and you want to choose the diabetes diagnosis that is already on the patient's problem list. And then when you go to sign the order, you have to type in per protocol. So that then that is sent for a cosign to the provider that you're flowing for. If you are doing a test that's not overdue but due in 2 weeks, say, as an example, the A1C is due in 2 weeks, then you would just pen that order and let the provider decide if they want to sign that or not. So this is the per protocol is only for tests that are overdue. Then the urine microalbumin, when you order it, it will generate a label that will be printed in the lab. You can use a regular urine cup to collect it. It's not a clean catch, and you really don't need a lot of urine to run this test at all. The label, there's different things that you do with the different stickers. The smallest sticker or label will go on the lab sheet, then the medium-sized label will go on the cup. And then you're going to put the cup in a bag and put the other label on the bag or inside the bag. And then you're going to put it in the fridge. And here's just a picture of what the label looks like and the different stickers. The A1C test is a test that you're going to collect after you've already checked vitals and done the med review. You're going to run the test, and then you will post the results in the chart and let the provider know the result. And that's it. This is our short little video on doing this. We really appreciate your help. We're trying to make sure that we capture people and get them up to date on their labs that they're due for when they're coming in for a diabetes visit. And it really takes all of us to get this work done. If you have any questions about this, you can certainly ask anybody on the diabetes team. Thank you.